Today, my guest is Stefanie Shimko Lin. Stefanie is a nurse and clinical analyst that's been working in healthcare for 20 years. She's worked on a number of groundbreaking clinical projects and is a published author. She has a wealth of healthcare knowledge, but brings a unique and seemingly endless passion to patient care. Stefanie, thanks for joining us on Things I've Learned. So I read the chapter that you'd written for the book, and obviously reminded me a lot of the amazing experience that you've had in finding ways in healthcare, working with patients, but also working very much with IT related to healthcare. And, all the amazing advances that have happened, the projects that you've worked on. Obviously, I recall the time that you and I had worked together on this. And what was so amazing is that it felt so significant, so rewarding, like we were actually doing something to help people. But at the same time, this can feel like very weighty, like, your entire life can start to feel consumed with helping others. You can always find more ways to help people. There's always more people that need help. You could become just overwhelmed with this never ending need. Um, I always wonder, for people who are doing this kind of amazing work in their career, how do you compartmentalize your job so you can leave it and go home? Do you ever feel guilty when you're going home? Like, do you ever feel like, well, if I just stayed another hour, I could do something else? How do you make that cutoff?
I'm still learning to do that. um, I now that I'm in IT, it's a little bit easier because there's not. While I know there's patients at the end of what I'm doing, I'm not directly impacting any one person. So I had more of a hard time when I was doing direct patient care because I would stay and I would work over 16 hours a day if I needed to, just to get, when there's somebody there who needs you at the end of it, you're like, I do have that amazing guilt that I can't drop it. Um, it's a little easier to do when you're in IT, like I said, because I'm not seeing the end result right away. If I'm doing reports or whatever, I'm not. The passion's transferred to something different, if that makes any sense.
No,
So,
it absolutely does. Yeah.
but I have had to learn because not too long ago here I was working quite a bit, and it totally impacts your home life and everything else around you, and it burns you out. And I've had to learn to make sure that I take off at 5 o'clock as much as possible. It's not always, but most of the time I get off at 5. Um, Go downstairs. I shut my computer off. I may still have my phone out every once in a while, but for the most part, I try and take myself out of my office as much as I can in the evenings.
Yeah, I literally spent 2 hours or 2 hours, 2 years working on that project with you. And at the end of it, I was just completely spent. Like I didn't feel like I could do anymore. I felt super burned out. I can only imagine you, who've been doing this for so long, how difficult that's got to be. Talk a little bit about that chapter that you wrote. I mean, obviously, there's a lot of very intense emotions involved in that. Can you describe a little bit about, how that feels? Your unique connection to all these people's lives, right? You're part of it. You are very definitely involved, but at the same time, obviously, you're kind of, as you mentioned in it, you're kind of like a bit player for a short stretch of time in what's going on with them.
Yeah. So when I became a nurse, I was 38 years old, and I was a secretary, medical secretary, 36, sorry. Um, I was medical secretary. I had an amazing opportunity to go to nursing school through the Cleveland Clinic. And I learned from some of the best, like the people that I worked for. I had some of the great physician assistants, physicians. I watched how they treated their patients. I learned how to treat patients as well. And the nice thing about them is, I know you mentioned somewhere, about being a highly sensitive person and the passion that I have, and they always let me run with that. Um, it's a double-edged sword, and it does weigh on you being on the floor. But I have so many patient stories um, of hugs and appreciation and thank you so much for taking care of us. People that may have gotten, a little lonely in the hospital. That same night, I alluded to a death, the first death that I ever had in the hospital when I was working as a nurse, and that Equanimitas story. Um, so the person who ran that code was a fellow that worked downstairs with me when I was a secretary. So I was doing my clinicals after that, and then worked in the cardiac department. But he was the one running it, and he just some people it gets very they get flustered and they yell, and it's not a very calm thing to be to doing with them because it's just so much adrenaline. And he just stood there and very calmly kind of told us all what we needed to do. And I was kind of like, wow. But it was also a moment where I had never. So when I became a nurse, I didn't want a job where you were going to have to tell somebody they were going to die. I didn't want to be around death. I wanted nothing to do with it. But this particular evening, the doctor that was there was one of the fellows, and she had to go and tell this family that their mother had passed away, and it was a couple days before Christmas. And I vividly remember everything about that night. And I've even talked to some of the nurses that I worked with that night as well. And all of us, we can all remember where we were standing, the sounds we heard, everything. And so that was a very big moment, I guess, if you will, because it's sobering to watch all that. On that same exact night, though, we had a patient on the opposite side of the hall that was it was Christmas time, like I said, and she was telling me that she missed her Christmas tree. So nurses being what we are, we had a little bit of downtime overnight, and so we took some boxes and colored them green and made Christmas ornaments and got tinfoil and made her a Christmas tree so that when she woke up in the morning, she'd have a Christmas tree. So on very opposite ends of the spectrum, she was thrilled and touched, and that's the part that I guess I get my yayas on is making people feel like that, making them feel understood, making them feel like I'm happy to see you. And you get a lot of that.
I mean, that's got to be so amazing. The best thing as an IT person, the best thing I can hope for in a lot of days is that I save someone a little money or something, right? I would imagine that the rush that must come from having done something for someone, made them feel good about themselves, gotten them through a really difficult situation, things that I've seen you do, and the things that I've heard that you've done. How long does the excitement and the feeling like you've done something amazing, the warmth that you feel from having done that, how long does that last? Does it ever go away? Does it ever get to the point where you feel like I've done so many nice things, if I do something today, it's not really going to affect me the way it did when I started?
Nope. No, when I do something nice for someone, especially if they appreciate it, it's not always appreciated. The nursing life, they don't always appreciate you. But when you've done something for someone and you can totally tell that it's made a difference for them, even if it's something little, it doesn't go away. I had a lady in hospice that I took care of, and she loved ginger ale. Ice cold ginger ale was her favorite thing in the whole wide world. And if I remember right, I think she had Parkinson's and she was missing a bunch of teeth. And so she had difficulty swallowing. And so you have to have orders for everything in the nursing world. So she wasn't allowed to have ginger ale because of her swallowing issues. And so I went in and I talked to the nurse manager and the physician that was in charge of her. And I said, is it just possible to get an order for this? Because, I'll make sure I give it to her. We'll sit together and we'll do it slow. And when I went out and told this woman that I had gotten her orders for ginger ale, oh my God, the smile on her face. I can still feel it.
That's
it
awesome.
was like her whole face lit up. And that's the stuff.
Yeah. And I get, you were the person who actually introduced me to the concept of someone being a highly sensitive person. It was super clear about you. Like you were so much like that. I'm so glad that, you can get that same gratification now out of those same kinds of experiences as you did, when they happened. Cause that's got to help, I think, hopefully lessen a little bit of the pain and trauma of the other things that you have to do, which are so difficult. So back to the highly sensitive person thing, we both, I think, tested really high for that in the online test. And it's been interesting for me to notice that now in others. My daughters are both, highly sensitive. Sometimes I explain to them that until you're in your mid-20s, being highly sensitive can feel like a real liability. Like basically it's a struggle to go through some of the things that you have to go through in your younger life. I feel like though, as you get older, it almost feels a bit like a superpower. What are the ways that you think this quality has been helpful to you in your life and also in your career?
Hmm. Yes, it's a double-edged sword. Um, I find that I have a lot of empathy, um, sometimes too much. And so it's a little difficult to control for me. It always has been. But I'm learning. But it I have a story when I became a nurse, I had it in my head that I was going to be the best nurse there ever was. And my grandma passed away right before I got my nursing license, and she said, "Steph, be a good nurse." And I said, "I will be, Grandma." And I took a job where it was very high paced, and we had a patient came in that was she was a little slow, and very scared. And I had a nursing student following me, and this is when I actually quit my job there. Because I realized she came up to me and she kind of pulled me aside and she said, "You're scaring her," because all of the things that you have to do, and all the check boxes that you have to check off, you completely forget that there's a person there that needs you to also hold their hand. Um, and when I didn't know what I was going to do, I had thought about going to be a medical assistant or something in that arena. Um, and I had a close friend of mine that took me around to the floor so I could shadow him and see what it was like to be actually in the medical world, not sitting behind a desk. And there was a patient that was in the ICUs, just had open heart surgery, and they were trying to figure out whether or not she had a blood clot that was keeping her heart from beating properly and having blood pool in her chest. And I remember her panicked look on her face, and everybody was looking at the monitor and looking at, the diagnostic part. And my friend just reached over and just gently laid his hand on her knee, and she like instantly calmed down. And I thought, that's what I want to be. And so I don't think I don't know if I would have had the drive to do it at that age if I didn't honestly believe that's where I needed to be. Like, I feel like the empathy I have has always been here. Um, my mom said I was like that as a child. I could like read people. Um, so that's that. In work, in my career, it's not only being empathetic, but it's that sensitivity goes a long way with knowing something's off. Like, you just have a feeling that something's not right. And that's both in my nursing and my clinical analyst career. I can always tell when something's wrong. Like, if it looks a little bit different or feels a little different, and the experience is a little different, then I notice those things. And sometimes I have a feeling I probably drive people crazy with it because I had a patient that had a stroke, and he'd been using the remote control the day before when I was taking care of him, and I came in the next day and he couldn't do it. And I was trying to tell the doctor that, and he's like, "Okay, I'll go check." But those kind of things. I just feel like something's off. And then when I work in IT, the same thing. I if I use something all the time, I can tell automatically something's off. I just get a gut feeling. I can't tell you what it is, but I got a gut feeling there's something wrong, and I'm usually not too far off. They used to call me the canary in the coal mine.
Yeah.
So I think in that way. And then also recently I've gotten a Reiki certificate. And when you provide treatment, you can actually feel where people are having stress or where like something's bothering them. And I haven't used that professionally yet, other than for some friends. So I don't know that you would have any interest in those kind of things if you weren't the highly sensitive type.
Yeah, kind of continuing on with the highly sensitive theme, and also you mentioned your mother, who I know you were extremely close to, and I think that's probably a pretty common trait then among highly sensitive people, is that they've got a really close connection to at least one of their parents. What do you think you learned from her? So obviously, you're going to have some natural tendency towards it yourself, but do you think there was something maybe that you learned from her that you took, directly into parenting your own kids, or maybe the way you treat everyone? Was there anything specifically that you would direct towards her as opposed to just something that was naturally in you?
Yeah. She always taught us to be kind. Her big thing was, but for the grace of God, there go I. So, don't treat people like if you don't want to be treated that way. Um, and I don't know, that was a bit of a guilt trip too, but it makes you think, when you're making fun of somebody, oh, that could be you, or you see somebody out on the side of the road, that could be you. Um, so I definitely think she encouraged the empathy. I also know that I was a bit of a tough kid because I was highly sensitive. Um, Even as a baby, I would not wear lace or anything like that because it just itched and I would cry the whole time. And on more than one of occasions, my mom had said, if you had been the first, you would have been the last. um, but I mean, she instilled a lot of integrity. If you're going to do it, say you're going to do something, you do it. Um, the empathy. She always tells a story, or used to tell a story about when I was little. Um, we had a big moth, like one of those giant moths, landed on our basketball pole, and it had a ripped wing. So I went inside and I was looking for some Scotch tape, and she goes, "What are you doing?" And I'm like, "I'm going to fix their wing." She's like, "That's not going to work." And I'm like, "Well, it might." And she's like, "No, it's probably not going to work." And I'm like, "Okay, well, then I think it was third grade, and I went out, I taped it, and she went, all right. And she said that, she said, you're always been very sensitive to these things. So, and I always used to get the pets that were sick. And, my parents would take us to get parakeets or whatever. And I always get the ones that were getting picked on. And she didn't tell me no. She let me take them home and love them. So, um, I try and do the same thing with my kids. The other thing is she always made you, like on your birthday, she always made you feel special, always. And I've tried to do that for my girls.
That's
And the
awesome.
surprises. She always surprised us with stuff. Like she would tell us that you're not getting it, like something you really wanted, which is actually kind of mean, but she did it anyways. Um, and then then when you got it, it was like a huge, huge. So that was something that she always did when we were little, and I've continued to do with the girls.
Yeah, I think that's so important. Like, I feel like, if you are sensitive, that you kind of need that person who's, maybe playing lead blocker for you in your life, right? For you to be able to get out of childhood and still be sensitive, I think requires maybe some of that, from a parental unit or somebody who's really close to you growing up. And kind of just what I would think would have to happen logically for you to be able to get there. It sounds like maybe that was your mom.
Yeah. And my dad was very good at that as well.
Well, that's excellent. So, you did probably one of the most beautiful things I've ever heard someone do for someone who is a virtual stranger. And that was one evening when we were actually doing some testing in a hospital, and you heard that a woman was most likely going to pass, I believe. And you stayed with her basically overnight while that happened. Can you tell that story a little bit, and then describe, what that feels like to be involved in someone's life when such an enormous transition is happening and you're the person who's basically there with them.
Yeah, sure. So that particular story, so I have been kind of all over the place in nursing, and hospice was one of those things. Um, and I did that for about a year and a half, and I realized how scary it can be at the end, and how like you learn to kind of look at things in a normal, like it's normal. This is all these things are normal, right? Um, and you mentioned that being an empath is a superpower. I always feel like my superpower is being a nurse. The minute I have my white coat on, I'm not afraid anymore. I can I can move mountains if I need to for somebody. And so that day I had happened to be up there working with you guys, doing testing some equipment. And I walked into this room. So my mom had cancer for 4 years and lost her voice at the end of it. And this particular woman had also lost her voice. And I walked in our room, and the MO was I'd go in there, explain who I am, what we're doing, and then you guys would be working, and I'd have nothing to do other than sit and talk to patients, which was perfectly fine with me. But she and I communicated. I got her some water and lipstick, not lipstick, chapstick. And I left because I think that the whatever we were looking at, we needed to look at further later on. I came back, and right before it was time to go home, and the nurse that was sitting at the bedside said, "Yeah, she's revoking care, so she's sending her family home." And I was like, "Oh, okay, so she's going to do that all by herself." Um, and I just remember when my grandma, she had done the same thing. She had congestive heart failure, and she said, "I'm not taking my meds anymore." And they put her in or she actually voluntarily admitted herself to a unit that was you call it? It wasn't hospice. It was palliative care, and she died there by herself. But she had nurses that were able to sit with her, and so I asked the family. They were on their way out, and I said, "Is it okay if I go in and sit?" And they're like, "Sure, that's fine." And then the hospice nurse was in there doing her orders and everything, and we were just talking. And I asked her if it'd be okay with her. I stayed for a little bit, and I just held her hand. I can't imagine being in a hospital and knowing you're going to go and having nobody around you and no one to hold your hand on the way out. And so I called my husband and said, "Is it okay if I stay here?" And I stuck around for a while, and I was there till at least 2 or 3 o'clock in the morning. Her family actually came back, and they asked her if they could stay, and she said no. They're like, "What the heck?" And one thing I learned in hospice is a lot of times, especially moms, they don't want you in the room when they go. It's a kind of a protective mechanism. And with me, I didn't mean anything to her. I was just some strange girl who came in to hold her hand. And so I told them that. I think they ended up coming back a little bit later in the evening when she was actually sleeping. But it's an honor. It's scary. It's a lot of things. Like I said, I didn't think I was going to end up in something that had anything to do with death because that wasn't my forte. But here I am. And you're also supporting the family. I mean, they weren't there that night, but you learn that you're part of their family as well if you're taking care. You're letting their parent out. It's definitely a strange feeling when you watch somebody pass away for the first time. And it's something I don't necessarily like to talk about with people that I do it for. It's happened on a few occasions where I've had to do that for some friends. And my uncle, I went to visit him, and he was on hospice, and he passed away while I was sitting next to him. My aunt came in, and she's like, "Sorry to talk about it." I'm like, "I don't want to talk about it. I'm here.
Yeah.
I'm done."
Yeah.
It's very personal. And it's much harder when it's somebody that's yours, but I do it every day. And I don't know if you were going to quote that, but from that William Osler poem, we help each other, help the strutters out on the stage. So I feel like I've done that. I've done birth to death, and what more is there?
That's amazing. Totally amazing. And I mean, obviously, we need so many people like you in the healthcare profession in general, who have that kind of passion and bring that just love of people into what's going on. It's amazing. So I kind of want to ask you in general, you're, I'm sure, seeing kind of the shift in nursing as it's going on. I feel like, millennials are growing to be more and more a larger percentage of the just nursing organization in general. And I feel like that may mean a shift in the way care is. I feel like, they've grown up with a very nuanced and empathetic take on interacting with people. And I'm just curious if you see a difference in the way they are. And obviously, you can't make generalities. Everybody's going to be unique and that kind of thing. But I feel like there's a possibility that there is a ton of empathy from that generation that maybe is playing out in nursing. Do you see that at all?
Yeah, it depends. I think depends on the nurse. I think there's a lot of people who get into nursing because there's money in it, but there's not really I mean, they think there's money in it. Let me rephrase that. There is probably now after COVID, but it's still a hard job. It's hard emotionally. It's hard physically. I've had a few surgeries in the past year, and I can tell you that some nurses were great and empathetic, and others were just kind of like, "Okay, well, I'll be back later. Um, so I think it's just it's kind of like everywhere and at all time. There's certain people that do it and love it, and there's certain people who do it and go home. Um, I worry about it a little bit just because there's so many, like when I went to nursing school, our instructors were all older nurses. There's a there's a definite edge to being older because you've learned the things that the mistakes not to make. And so, having somebody there to guide you and say, okay, you don't need to worry about this. This is something to worry about. This is not something to worry about, because you learn your skills, but you also learn a lot on the floor by being around people. And I feel like maybe that's a little bit harder to come by anymore because a lot of people are retiring. But I mean, my daughter became a nurse, so I'm very, very proud of the nurse that she is. She's definitely got empathy in spades. So it just I think it just depends on the person. I honestly believe nobody goes into this without having some sort of empathetic nature and want to help people. But I do think sometimes it's a little harder to do if you, especially like during COVID times when there was so much getting beat up. But overall, I think anybody gets into healthcare because they want to help.
Yeah, that's awesome. And you're kind of describing something that is happening probably in every career, in every field right now, which is that, the previous generation, as they retire, the mentors and the people who really understand what's going on are disappearing and the new people are coming up. But obviously in healthcare, that is so important and probably so noticeable because, the stakes are so much higher.
Yeah, for sure. And they, there's a lot of research that people do. My personal experience, I had to have a shoulder replacement done, and my OT provider is retiring in about 2 weeks, and he's a wealth, like a fount of knowledge, and he's practical, and he teaches and he writes papers, and they're losing that. It's that knowledge base is going to be gone. So I'm hoping he will continue to teach people because there's book smart, and then there's putting things into practice, and I think we need a lot of both.
Right. And again, yeah, so significant in healthcare, right? If a banker retires, you may not be as profitable the next year, but the stakes are not nearly as high.
And not to make it sound like other jobs are not important. I know plenty of them are, most of them are, but and people who haven't done healthcare, and I've done both, so I can say this, there's a very different urgency when you're taking care of people as opposed to not. There just is. It seems that most people think that we're all, we want everything now, and it's just a very different urgency. And so you need a lot of that, a lot of backup, a lot of teaching, and also a lot of open-mindedness for people to teach you new things.
Yeah, it makes sense. So kind of thinking, we're discussing a little bit, I think the future of nursing and how you think that's changing. And one of the things that I think about a lot is as time goes by and as we see people living longer, and we see, physical issues being things that are able to be treated. Not only because people are living longer, but also medicines are getting better, and just healthcare in general is helping people live longer. The thing I worry about is what the impact that is on people who are older, but maybe haven't had that opportunity to take care of, mental health, but very specifically in terms of them staying connected to others. Someone who is in pretty good health, but not super mobile is going to be very isolated.
Yep.
What do you think in general? Like, are there things that people can do to be able to stay connected and involved, communities, families, those kinds of things, so that it isn't that they have longer life, but they don't have the youth that has to go along with that for it to be a good one?
Yeah. Yeah. I'm actually going through that with my dad right now. It's hard because, I think it maybe a little bit of a different challenge later on for our like generation, because we know how to use computers, we know how to, do Facebook and, use cell phones and text. And, he's in his 80s. I think he just turned 85. And he just about knows how to use Facebook. And so he's limited in his ability to interact. He goes to church. They have like it's North Homestead, so they have like a senior center that you can go to and you know have lunch, make crafts, things like that. Um, it's difficult. It's not just your health per se. I had one of my other patients said she used to like to go. She worked in or lived in an assisted living, and she couldn't hear. And she's like, I'm gonna die. I'm not gonna get any hearing aids. I'm like, well, maybe you should. And she was like, nope, I don't want them. But she stopped going to dinner because she said people thought she was snobby because she didn't say anything and she couldn't hear. She just sat there. And I think there's a lot of all sorts of things that drives a wedge between, older folks and getting out there and having fun with people, or at least bonding. I know my dad's church is very important to him. He's got his community there a lot. And then, then you've got the families that are really busy. So, making the time to call them, have conversations. I'm not sure how we're going to do it because we're so electronic now. I don't know what's going to come next when we're in that phase of life.
Yeah, it just seems like something that I certainly hope we, as a society, find, great ways to be able to figure it out. Because, that's really something that I would see as being a chronic issue just for people in general, even as younger people are finding themselves more disconnected. Obviously, it's going to be
Yep.
very easy for the people who are older and again, not as mobile maybe to have that same issue.
Yep, for sure.
Well, Stephanie, thank you so much for coming on and talking with us today. Appreciate all your insight. And again, just, working with you is wonderful. Being able to see what, passionate nurse you were and stuff was just an absolutely amazing experience. Thank you for coming on. Things I've learned.
Thank you, sir. And I've missed seeing you. We got to get together.
Yes, we do.
All right.